Welcome to one and all to the pilot episode of Pragyan Talks, a talk series which aims to delve deep into pressing topics to provide insight to the audience through esteemed experts across the globe. The series focuses on the aspects of life after the immediate danger that the pandemic poses once it is averted to a considerable extent. But is it possible to know when the crisis would end? To discuss this and more, we have with us a vividly eloquent speaker who is the founder and director of the Center of Disease Dynamics, Economics and Policy, CDDEP. Professor Ramanan Laxminarayan is truly the best person to explain the consequences that the pandemic has on the economy and maybe even vice versa. Welcome, sir. We are very delighted to have you on board. And on this note, we'd like to start the interview.
The purpose of the lockdown at the very initial stage was not to contain the disease. In fact, in a country like India, you can never contain a disease once it has come in. You can contain it in a small island or a place like New Zealand. So the purpose of the lockdown, we have to remember, was only to buy a little bit of time, maybe 1 or 2 months, to prepare the system, because the system was just not ready for having hospitals be flooded. Most hospitals don't have ventilators, don't have the staff, the clinical protocols are not there. So the lockdown could have only been intended for that purpose. Now, there might have been some expectations that the lockdown can achieve more than that. But amongst those of us who are advising, the situation, that's all we said was possible. You can buy yourself 1 or 2 months of time. So the 2-month lockdown, they've spent some time in terms of preparation. That's why you have the railway coaches that have ICU beds. You have hospitals that have clinical protocols. The doctors are there, the purchase of personal protective equipment, and so forth. Then comes the time to remove the lockdown, because the lockdown destroys the economy. It's the biggest killer of the economy, and both for rich and poor people. So it is not a long-term solution to protect ourselves from the disease. The long-term solution is only for people to socially distance, to follow rules, to wear masks. These are the only ways in which to do it. But from the economy's perspective, it is time to go back to regular work, obviously with some changes, around office and maybe, malls and stuff might stay closed in some places. But the economic hit from the lockdown is tremendous. I don't think the country will recover for a bit, at least for, a couple of years, because that's as long as it takes to fully recover from such a big hit. And even before that, the economy was not doing that well. But I think the move to continue and unlock is really the best solution. If anything, I would have called. I mean, I did call for the lockdown to be lifted after 28 days of lockdown, which is the only productive period. After 28 days of lockdown, it really doesn't achieve much of the goals. See, much of what India needed to do about the pandemic should have happened 20 and 30 years ago. It's how you invest in your public health system. It's how you train doctors and nurses and people who manage the system. There is very little, honestly, that you can do in the middle of a pandemic to prepare for the pandemic. All this needed to have happened well in advance. So I don't think we should be too harsh on ourselves. We have a big population. It's a very densely populated country, and there is only a certain amount of control that you have over a viral disease. This is not a measurement of effort in a sense. It is a reflection of the effort that has been put on health over the last 20, 30 years, which is actually, I would say, even going back 50 years, which is not a very strong emphasis on health. So if the country performs not so well, which it is not, it is no surprise, because those investments were never made. If you don't build public health facilities, if you don't train the public health cadre, I mean, you can't train them in 45 days just because you have a pandemic going on. So I think we have to be realistic about what to expect. Is India going to do supremely well? Not that well. Is it a failure of the people right now or the country right now? No, because everyone is doing the best that they can at this particular point in time. I think, given the situation, state and central governments have done what they can. Certainly, there are things they could have done better on testing and preparation for hospital beds and so forth. But that again is a lack of familiarity. If you don't have health be a core part of what you think of as governance, then you can't acquire it suddenly in 2 months. Well, I don't think we're even through the first wave, so forget about a second wave. It may be a long time before we're done with the first wave, and India will hit probably something closer to a plateau where we will have a high number of cases for a lengthy period of time, maybe 3 months. And so I think it's too early to worry about a second wave. There were particular evolutionary reasons why the second wave of the 1918 flu pandemic was more deadly. It had to do with the selection of the pathogens in the first wave. Those were people in trenches in the First World War who were easily transmitting to each other. So the virus didn't lose anything by killing people. Generally, viruses suffer when they kill people because, from the virus's perspective, a dead person is a dead end. It's like going to a road which is not going to go anywhere because they can't transmit. So viruses don't prefer to kill people. It's part of their getting to know us that they accidentally kill us, and we are also, our immune response is very strong. So I think A, it's too early to tell, and B, it may not even be relevant. India might not have a second wave if the first so-called wave just continues for a period of time and we reach herd immunity in that period. It's really too early to tell. It's a good point about vaccines reaching the masses. There are many steps in vaccines. The first is to find a vaccine that is safe. After the safety, you look for efficacy. Does it actually protect people at scale? Because if a vaccine is only 20 or 30% effective, it's not worth handing out to everybody, right? So safety is one thing. Second is effectiveness. And then the third stage is manufacturing. How do you make enough of the vaccine? And then the fourth is delivery. How do you deliver the vaccine? Now, in a country like India, uh, delivery of the vaccine is not easy. Even for childhood immunization, which has been a program since 1985, we don't deliver vaccines to more than 75% of the children. So when we are not able to deliver vaccines to 100% of 26 million children, how likely is it that we can deliver vaccine to 800 million people if we can't do to 26 million children very easily? So that's one thing to keep in mind. Second is getting a vaccine that's going to be safe and effective. The earliest that this has ever happened is 4.5 or 5 years in the case of an Ebola vaccine. Many vaccines against viruses have never been found. So we don't know if we'll have a vaccine in the next 6 months. We're all trying, hopeful. There are 120 or so vaccine candidates, and and the leading ones are about 5 out of China, a couple from the UK, and 3 from the US. But we don't actually know if any of them will be safe and effective. Third is manufacturing. Nobody has ever manufactured vaccines in doses that are more than 50 or 100 million doses. That's typically the maximum that you'd aim for, because that is the birth cohort of the world, because most vaccines are made for children. So you're asking a system that makes 100 million at the best of times to say, I want you to make me 4 billion. That is beyond the capability generally of the system. So even if we had a safe and effective vaccine, it's not clear that we can know how to make it at such large volumes. And finally, like I said, even if we make it in such large volumes, we don't know if we can deliver those vaccines. And all these vaccines have challenges which are not trivial. The Moderna mRNA vaccine needs to be stored at minus 80 degree temperature. We don't have the cold chains in India to maintain anything at minus 80 degree temperature. A different vaccine might have a different set of challenges. So I think a vaccine route is going to be very challenging, and it's going to take time. I'm not saying it's impossible, but the odds are, it's a very rare thing that all of these things actually work out. So it's worth trying, but it's not something that one should bet on. So the R naught has nothing to do with the lockdown. The R naught is a function of a virus or a pathogen itself, which is in a population that is completely naive, which has never been exposed to the virus or a microbe, how many secondary infections does one single primary infection generate? So R naught is it's almost like a natural feature of the virus, of the microbe. Now, the effective reproductive number, which is called R or R of T, depending, so it's the reproductive number at a particular point in time, changes from the R naught. It changes either because of population density in a particular point. It may change because of lockdown. It may change because of individual behavior. All of these can change the reproductive number. Like for malaria, if you were to use bed nets and spraying, you can reduce the effective reproductive rate. So the lockdown uh, has a different effect on this effective reproductive number in different places. India had a very harsh lockdown, but not necessarily a very effective lockdown. It was as good as India is possible to do. Remember, you can't wish away poverty and density of population just overnight. That's just going to stay with the
Yes.
country. So the lockdown did reduce the reproductive number, effective reproductive number, and the lifting of it will bring it back up. But these are only to be expected, and it's going to also be different in different places. The reproductive number is going to be very different in Rajasthan than what it is in Dharavi, just because of the structure of the population.
Hmm.
Herd immunity is not a strategy when it comes to getting infected and acquiring it. Herd immunity is used in the context of vaccination to say that if I vaccinate 6 population, that's enough. I don't have to vaccinate 100% of the population. That is a sense of herd immunity, because once you reach 60, 70, or 80%, then it is difficult for the virus to jump from someone who is infected to someone who is not infected, because there are many people who are immune who are blocking the virus. So it's like the immune people are protecting the population because they're making it very difficult for the virus to jump. That's what slows the virus transmission down. Now, in the context of a disease for which there is no vaccine, the concept of herd immunity is not a strategy, it is rather an outcome. And it is an outcome of the disease spreading over time. Now, ICMR says that as of mid or early May, there were 0.73% of the Indian population had been infected by coronavirus. Now, 0.73% is only 10 million people, and it's a long way away from, say, 60%, which you need to get to for herd immunity. And the herd immunity formula is also very simple. It's R0 minus 1 divided by R0. So there's no magic there. It's a very simple formula to actually derive. Now, if you assume an R0 of 2.8, 2.8 minus 1 is 1.8, divided by 2.8 is about 65+%. Now, if we think that the R0 is only 2, then it's 2 minus 1 divided by 2, which is 0.5, which is 50% is the herd immunity level. So herd immunity is an inevitable consequence as the disease spreads. If the vaccine arrives before we get to herd immunity, we don't have to worry about it, because we'll get the vaccine out. If the vaccine does not arrive as the disease is spreading, then also the disease will die out because of herd immunity. So herd immunity is just a natural endpoint which says that not every person in the population has to be infected before the disease dies out. The disease will die out well before that. Well, I think people are conscious about their health in some ways, but not necessarily. Um, See, it's not easy to wear a mask at all times. It's not easy to always wash their hands. So because a lot of people don't have running water, they don't have soap. So it is easy for those who have the means to do it to change their behavior. But it's not always a matter of behavior. It's also having the necessary tools to be able to comply. So I think that people have changed behavior because they are scared of the virus. And a lot of people think that if they got the virus, they would die of it. And there's a real fear factor there, which is not the idea that we would want to communicate. What we really want to communicate is that this virus can kill you, but most of the time it will not. Most of the time it will not. It will just be a mild infection. But I'm sure that if you told someone that you had COVID, they'll all run away from you. So this is, again, a question of stigma and fear. And I think that fear has made people change their mind about the disease. But it's also possible that, in places where the disease is not yet prevalent, they might not care about it because they don't see many cases and they let down their guard, and then the virus increases. So our behavior is an important protector for us against the disease, but we have to learn to adopt these behaviors even when the disease is not very prevalent, and not just do it when the caseload and the deaths numbers start going up. Well, these pandemics are always going to happen. We don't know if the next one will be next year or it'll be after 100 years. We really don't know. So it's going to be, it's not really clear that way. So I think the important things about dealing with pandemics is to realize that A, they will happen. B, that the best preparedness is to build a good public health system which works even when there is no pandemic, that you have the staffing, the medical system that's available, the public health system. Much of what health is has nothing to do with being a doctor. In fact, doctors are not the most critical piece of the public health system. Public health system is people who do logistics, people who are able to deliver vaccines, people who, engineers are part of public health. Because at the end of the day, we don't need a doctor to either make a vaccine. We don't need a doctor to figure out the cold chain to take a vaccine to the remote location. We don't need a doctor to deliver the vaccine. So there's a misperception that much of what public health is actually being a medical doctor. And in fact, very little of public health has to do with being a medical doctor. They're an essential person in the system, just like, other people with expertise are an essential part of the system. But public health is this much broader thing which involves many different expertises, which all need to understand that health is not an individual thing alone. It's something which links to all of us as a community. Why do we think that way? Because everything that we do, infectious disease jump from one person to the other. If you think of chronic diseases, what we eat, what we breathe, the air quality, all these affect our health. So health is really something which is not about medical sciences alone, although that's a part of it. It's really around many other things that require a lens of thinking about from a public health standpoint. And it is because we don't think in that public health sort of way that India is really unprepared for a pandemic. I mean, I think the virus is going to stick around for a while. It may come back in a different form, a little later. But I think I'm hopeful that perhaps over time there will be a vaccine, and I don't think we're going to have to live with this virus for years and years. It may be, in a country like India, because we can't control it, we will hit herd immunity much faster than many other countries. And we may suffer more in the short term, but we'll gain more in the long term. And some other countries may not actually have reached that herd immunity, and they will have to figure out how to get out of the virus. So I think it's going to be a very kind of a thought process as to what the future will be with respect to corona.
Thank you very much for giving us the interview, sir. It has been very insightful for us. We have learned a lot during this interview. And thank you for taking your time out for this particular interview. Thank you.
Thank you. Best of luck.